So we're just going to talk about a bit about what we've been doing in Helston, both in the medical centre and then linking into the wider community and working with Helston Climate Action Group. So just start off talking a bit about what we've been doing within the practice. So if we have the next slide. And, the next slide.
What can you see now? Can you see NUS Green Impact?
No.
You can't see. What can you see?
No. Helston, West Cornwall.
Has it changed?
Can't see that one. How strange. Okay. I wonder if I'll. How strange. Okay, I'll see if I can do it this way. It's a slightly different way. Oh, that's a bit odd. Can anybody see that?
I can still see the first slide.
Still see the first slide.
Yes.
Okay, see if I can do it a slightly different way in a second. I will stop sharing. And I'll just try and do that again. It's very lovely, the presentation, by the way. I'm going to try and do it a slightly different way. And tell me what can you see now?
The second slide, yeah, that's fine.
Yeah, is that okay?
Yeah, so we started off just by using the Green Impact Health Award Toolkit. So probably most of the practices represented in this meeting are aware of it. But yeah, set up by the RCGP, it's a really good place to start in terms of making green changes within the practice. Covered a lot of the points that Kath was talking about earlier in terms of changing inhaler prescribing, deprescribing, a bit what Saskia was talking about kind of advanced care planning, tech forms and preventing unnecessary emissions, looking at energy and water use, waste and recycling. So many kind of different aspects. There's a really good toolkit to use to start making changes. So we're kind of working towards the bronze award on that at the moment. And then next slide.
If it'll let me. That one?
Oh yeah. So a couple of kind of outside of the Green Impact Programme, a couple of recycling schemes we've been using. So first of all, the medication packet recycling one, so that's through TerraCycle, and it helps support Marie Curie. So we set it up only a few weeks ago, but it has an incredible response from patients on social media. Kind of loads of really positive comments, and I went to check the bins only a few days after we advertised it, and that huge stack was already filled and the bin was full up again. So we've had an incredible response. So we've got a contact at Marie Curie that's collecting them for us. Unfortunately, they're not accepting any practices to set up as a formal collection point, but they can be dropped at Superdrug in Redbridge, Truro or Falmouth. So any practices in those areas can signpost patients to drop off their medication packets there. So they otherwise wouldn't be recyclable, and it helps raise money for Marie Curie as well, which is great. Another recycling scheme we've been collecting for is hard coloured plastic recycling. So we've got a bin in the staff room, and that's particularly we've been collecting kind of the plastic caps of phlebotomy needles, which are often just put in the bin. So those kind of hard coloured plastics, and they go to a local business in Constantine called Cornwall Plast, and they make kind of pots, planters, candle holders, kind of gifts out of recycled hard plastics. Next slide.
Annette, can you let people in, because I can't see them if I'm doing this, if that's okay.
Yeah, no problem.
Thanks, Annette. Brilliant. Over to you, Laura.
Right. Earlier in the year, we set up this staff virtual Coast Path Challenge to try and encourage kind of physical activity and walking instead of driving, and particularly kind of travel to work for staff. Yeah, it's mainly competitive people get. It's quite effective at encouraging people. So that's been a good competition, kind of watching everyone's virtual dots move around the map. and so you have to complete the distance of the coast path within a year, 630 miles. And at the end of it, if you complete it, you get a tree planted for you, which is quite nice. We've also been trying to involve our GP trainees. So we did a whole afternoon tutorial for all the GP trainees in the PCN on climate and health issues, which Amanda kindly came and spoke to them as well and helped inspire them. And they were really keen and enthusiastic, and hopefully some of them are now taking on green QI projects. So all the SD3s have to do QI projects as part of their SD3 year. So a lot of them are keen to do a kind of green themed project and help make a difference in that way. So that was really great. A group of us from Helston Medical Centre also went to the lifestyle conference last month, which was really great. It ties in really well. So trying to think about, as people have been saying earlier, kind of exercise, diet, sleep, all those kind of aspects in terms of preventing and treating a lot of health conditions.
Laura, can I ask a question at this point? The question is, that afternoon tutorial, was that the meeting that I attended, or have you done something different to that?
No, that's the one you came to and spoke to them at.
It was. What was the general response of people who, when they were to that sort of training on climate and health issues? Because obviously it hadn't, from the conversation that we had, that hadn't been included in their training in the sort of the standard establishment institutions up to them. How did they feel about engaging with this as a new area or a new framing?
Yeah, it was really, really positive. So I sent out a survey to them afterwards, kind of asking how important they felt the issues were, and they all kind of said they felt it was essential to be included in their education and training. Yeah, that said that the kind of baseline knowledge of climate and health issues wasn't that great, but they learned a lot from that afternoon and were really keen to take it forward and do their own projects and find out more. So yeah, it was really, really positive feedback, which is great.
Brilliant. Next slide.
Yeah, and then obviously we're working with CAP and the primary care action group on the bigger changes as well. So starting to talk about kind of electric vehicles for our visiting paramedic and green tariffs and those kind of bigger issues that we're trying to tackle. So I'm going to hand over to Leanna to talk about our social prescribing and linking in with the visiting climate action group.
Brilliant. Thanks, Laura. That's fab. And there's lots of stuff that Laura, again, sort of understated all the things they're doing in-house and the complexities of making that happen on top of being a GP. And I don't really know how you do that, actually. Some sort of magic mushroom thing going on there to enable you to do all of those things. But really, really impressive. And I would highly recommend that anybody who's doing this talks to other people that are doing this to find out, as we've said in the past, how it all fits together and how people don't go mad. We know it's all the same thing, but it's still at the moment ending up being something extra to our work. So yeah, brilliant. Congratulations to anybody doing this. Sorry, Leanne, over to you. Lovely to see you again.
Hi everyone. So yeah, I was going to talk to you a little bit about some of the ways that we're sort of connecting. In particular, we're sort of under the green and blue sort of social prescribing agenda. The first one there is we've connected really well with Nature Connects, which is a local company run by two sort of really passionate people about the environment. And they've been recently putting on woodland wellness sessions over 6 weeks. So actually helping, obviously, with the mental health and getting out into nature, and they're sort of very, very knowledgeable about everything eco. So actually they sort of teach people lots of things about the environment, from birdsong and like how to light fires. One lad, a 30-year-old gentleman who I signposted onto this course, which was fully funded, and he loved it to the extent where he was on the brink of actually, he was very anxious, very depressed, and I think he was offered antidepressants, and he wasn't sure if he wanted to take them. But actually, after attending this course, he didn't go on to actually take them. Also, one thing I haven't put on this presentation, the same gentleman, I've referred him into the GP exercise referral scheme, which we've now got 2 local or one leisure centre and one local fitness provider, which is absolutely great. And the same gentleman was referred on to that, and he's lost like half a stone within the first sort of 2 or 3 weeks. So just that one person has got a lot out of these 2 referrals, and he's enjoyed going back into nature, and he's even got a job for 2 days a week. So that's a real massive result, I think, of not taking medication but actually getting out into nature and just working sort of things naturally and very holistically. The low-level walking group was something that was set up before the school holidays, sort of earlier on in the year, which, as I said, it's a very low-level walking group, and it was designed for people who are actually very either anxious of getting out of the house after COVID, not sure how to if they wanted to meet people, or people with sort of mobility issues that couldn't walk very far. Because there's quite a few walking groups in Helston and surrounding areas, but they're all sort of 3 miles plus, and it's like actually that's too much for some people. So this was set up at the boating lake in Helston. So if anybody knows that, there's lots of benches around the boating lake, so people could sort of walk at their own pace and rest if they needed to. So we had an 81-year-old gentleman who'd had like 5 strokes, and to be fair, he was the fastest one of the whole group. He really enjoyed sort of walking around. And one gentleman who was really, really anxious and didn't talk to anyone the first week. But then as he progressed, he was talking about all the birds and how his interest in wildlife, and we were sort of going to get a book and sort of so we could mark off what all the different animals were as we were sort of walking around the lake. That unfortunately has come to an end at the moment, but we are looking at setting up one again because it was so successful. We do have a referral route into the WAVE project, which I'm sure many of you are aware, sort of water and surf therapy in Newquay, and they've actually got their own allocated sort of social prescriber as well, so we've got a good referral route into them. And the other thing I think, again, I forgot to put on the presentation, I've set up a couple of companions, not necessarily sort of linked into climate necessarily, but for when I talk to people, a lot of people just want the simple things, and they've said, I just want to have a cup of tea and a chat. So we've set up at the local Wetherspoons one afternoon a week where people can just come along and literally just do that, a cup of tea and a chat. No hidden agenda, just come along. So this actually the third one's this afternoon, which I'm not at, but the first week we had 3 people, last week we had 7 people, and they've already decided they want to have a Christmas lunch in there and the week before Christmas. And again, a whole range of people, some people who are just lonely, want to come and have tea and coffee, some people that are anxious, or some people just need motivation to get out of the house, and if they know they can be somewhere for 2 o'clock, then it gives them that sort of boost to get out. So yeah, so that's a few things that we're working on. Next slide, please. Parkrun practice. I signed the Helston Medical Centre up as a parkrun practice. What I didn't realise, I was going to be roped into going along as well. So, which has been really positive. So, as you can see there, the first week I think there was about 3 or 4 staff on one patient, and last week there was 8 staff and a doggy that turned up. So we're obviously going to be working on getting staff involved, and more importantly, getting the patients involved and as social prescribers, that we can, support people and walk with them all the way and just again build up their confidence and get them out and about in nature and giving them a focus. And I think that's a lot of the thing. It's giving them a reason to sort of get out of bed in the morning and keep fit and meet people. So yeah, so that's going to be an ongoing thing. Now we're even talking about doing it on Christmas Day. Okay, next slide.
Dedication.
Plans for next year. I'm in the process of setting up and planning a health and wellbeing fair in January. That will be at the Helston Cattle Market. And basically, I'd like to see it as like a big social prescribing fair, really. It's everything what social prescribing can offer all under one roof. So that will be everything from people like Incredible Edible and Nature Connects to housing, debt, memory cafes, exercise, you name it. So we've got about 20, 25 people, different agencies coming. So the idea is it's going to be big, bright, colourful, and hopefully really successful. So that's the plan for January. And also you're going to hear from Melissa after me, I believe, and we're working at the moment. We've got a little small stretch of grass by the side of the surgery. It's not very big, but we're hoping to, in the new year, work with patients and with Melissa to see if we can set up some sort of raised bed, be it, I don't know, it's over to Melissa really, or whatever we can put in there, be it wild seeds or vegetables or whatever, or flowers, but with the idea that has involvement from the beginning with patients. you know, as a social prescribing sort of hobby, if you like, so to get them involved from the beginning, and also good for the surgery. So yeah, so that's me really.
That's brilliant. Social prescription as it should be. That's fantastic. Thanks, Leanne. And loads of stuff there, and a brilliant connection with. Just so you know, well, the social prescriber up at Hale is now getting very positively harangued by GPs at Hale because they've seen what you guys are doing with the local climate action group, and they want it to happen in Hale. And the Hale group has been very active but isn't active at the moment, and you're making all of this now a possible thing that other people want. So just so you know, you're being very contagious in the best possible way. So thank you for that. Melissa, are we heading to you now?
Yes, please. Can you hear me okay?
I can. Can you see the right slide?
I can see the right side. That's awesome. So yeah, so I'm a neurophysiotherapist, member of Helston Climate Action Group, and a town councillor. So I sort of come to this with my managing people with long-term conditions head, which is brilliant, thinking about participation and getting people out and about. But yeah, just coming back, I want to talk a little bit about Helston Climate Action Group, which was formed in 2019, and part of that process involved the co-design of the Helston Climate Action Plan, which is a really sort of thorough document, and developing projects with the community across the usual themes, so transport, energy, engagement, and green spaces. And what part of that process was to look at the co-benefits of all the different projects, and there is virtually no project in the entire document that doesn't have a health and wellbeing co-benefit. So this like amazing connection that we're all familiar with between different activities within the community and the health of the planet and the health of our community is you know, is really underpinned by that action plan. That's available on our website. I've got a couple of links on the slides for you. Can I have the next slide, please, Manda? Sorry, hectic slide alert. So this, I was trying to summarise all the things the things that we're doing with the Climate Action Group in about 3 minutes, which was, I'm not going to lie, was a bit tricky, but that's quite exciting to be able to say that. So we've got a few projects. I just wanted to talk really briefly about them. We've got a community carbon reduction project, which is using Geeky Zero to engage with the community to help them understand and reduce their carbon footprint. And it's fair to say that personal carbon footprints are a little bit controversial at the moment, because actually what we need is massive systemic governmental and organisational change, which I'm not sure we're going to get. But this has been such a useful vehicle for getting people to have a conversation and understand the impacts of the choices that they make. I've got Maggie, I've got a picture of you there doing some tree planting. So Maggie is our Helston Climate Action Group lead for tree planting, essentially. And by the end of this year, Helston Climate Action Group will have supported the planting of over 3,000 trees in the Helston area, including working with schools and different organisations. We had a raking cake event, which was at the graveyard, which I know cakes, we have been talking about diabetes, so maybe that's not quite so popular, but once you've raked 20 square metres of grass, you're going to deserve a bit of cake. So that was just thinking about how all those activities outdoors are really good for fitness, for reducing isolation, for improving self-confidence, and basically being present in a green space we know is really good for our health and our mental health. We have a repair cafe, which is currently on hold, but that has been, I think, one of the most useful sort of side effects of the repair cafe, which was really about people bringing broken stuff and getting it fixed, was the social aspect, and people coming and working side by side, talking to each other, people that might have retired and might have had a bit of an impact on their self-esteem, realising that they had a real role to continue to play and skills to share. We've got a community larder. We've got a community larder, which is on hold because we're trying to organise volunteers, which is one of the challenges that we face. But in the first 4 months that was open, over a tonne of food waste was saved. The larder was supporting between 30 and 40 families in the area, and it gave us another sort of vehicle to offer support. So we have groups like Community Energy Plus and Chaos attending those sessions so that people have a chance to speak to them. We've got a bit of a captive audience, which has been a really good way of reaching out and offering support. We have a local food Hub, which is an online platform for people to purchase locally grown food, which has been produced well, where they've cared for the soil. It doesn't have food miles, so that's all really positive. And in the middle there we have Incredible Edible Helston, which is looking particularly lovely and growing very well in that picture. But the construction of the garden was a process which involved the whole community. And we had a partnership with Who Dares Works and Rebuild Southwest, where they support people back into participation in employment, essentially, so people that aren't sort of financially stable, giving them soft skills, looking at their self-esteem, looking at building their communication skills, and also teaching them to construct, in this case, our awesome oak raised beds, so that we could plant them up with loads of good food in the community garden, which is basically a model where everybody has access, everybody can plant stuff, everybody can harvest, everyone can water, everyone gets involved. And I had a really lovely conversation with one of our lead volunteers at the weekend, who said that it was, bless him, he must have maybe had a perception that, you know, as Amanda said, this stuff doesn't get easier, and some days are more tricky than others. But he said, if you're ever in doubt that the stuff that we're doing is worthwhile, he said, I had a conversation with a lady today. She came into the garden, and she's at low income. She doesn't have her own space. She doesn't have her own garden. And she comes here because she's got cancer, and as part of that, she has to drink lots of water, and she picks the herbs. We've got loads of different herbs in our garden. She picks the herbs and collects them so that she can flavour her water and just make it more palatable. And it's been really, really important for her managing her health condition. And she was so grateful for that community space that had been created. So that was a great link, essentially, between, at this end in the community, what's going on, and having a sort of direct impact on, sort of our drop in the ocean is someone else's, significant event. Can I have the next slide, please, Amanda? So I am involved with Helston Town Council. I'm a councillor. I started doing that this year, obviously with the Climate Action Group, and that picture of lots of people is to represent all the stakeholders that we work with. So we work with churches, schools, volunteer groups. We are now working with Helston Medical Centre, which is very exciting, and the bees are representing the cross-pollination. So we have Helston Town Council. I'll say two things because I know there's not much time. The first thing is, woohoo, we had our policy and finance meeting yesterday, and we have passed an awesome environmental policy, which I would say is fit for purpose, and also an investment policy which has ethical investment up there in the top 3 decision making about where we put our money above yield, which is great, which it means we're going to have to challenge the current bank that we're using, and I won't disclose who that is, but it ain't one of the good ones. So we have also, or I've sort of been pushing on the climate education front within the council to really think about how we can develop a culture where everyone in the council understands what the issues are, so that we can make some good choices and good decisions on behalf of the people we represent. And I'm fortunate enough to be doing that with Amanda and Peter Lafort. So we're co-designing solutions-based workshops for the council, and a really big aspect of that is making sure we've got trusted messengers delivering the information, and so that's where Helston Medical Centre have come in. They're going to be supporting us with some presentations, so that we're hopefully getting the attention of everyone in the council using different voices, and hopefully there's more chance of them being heard. The little bit at the top is just me kind of trying to be diplomatic between the Climate Action Group and Helston Town Council. And the 2 Bs at the bottom, Leanna, I thought that was you and me the other day when we finally got talking to each other after not being able to get in touch at all. So, of course, we're working with Leanna and Helston Medical Centre. The manager there has offered us the grassed areas and also some raised beds at the front to think about what we can do. And Leanna and I have hatched we've got a time frame now, haven't we, Leanna, where we're going to be starting in 2022 to co-design the space, working with patients and thinking about how you start from the soil and you work your way up. So hopefully it's essentially it's an education, really thinking about how soil is so important to the health of everything that comes from it, and that's something that begins all those conversations that are really useful that we were talking about today. I'm going to hand over to Jim.
Brilliant, thank you, Melissa. That was awesome, tons packed in there. And I'm thinking there's definitely something here about a connection between people who are working in health and soil, and the connection of the land around health premises, whether they're surgeries or bigger premises. There's definitely a conversation there that needs to happen, I think. Thank you so much. Brilliant. Jim, over to you.
Right. Yeah, thanks. If I can go to the next slide, Amanda, that would be great. So yeah, my name's Jim Tate. I'm primarily a GP in Helston, but I'm also the kind of clinical director for the South Courier and Helston area, and sometimes get to speak on behalf of all the PCNs in the West. So I was just trying to put a sort of a slightly sort of wider context on where the best levers might be. So I'm very fortunate to meet Amanda. I think it was probably the best part of 3 years ago now. I was part of a respiratory project looking to try and improve sort of primary care, secondary care in the third sector, and how it would improve continuity and care closer to people's homes. And I think we probably had a really narrow remit around sort of tweaking the coordination of all of those teams. And then this big sort of this whirling dervish called Amanda came in and sort of challenged us around the need to consider housing and pollution and climate change as part of that respiratory plan. And I think, along with probably everyone else sat around the table, I think everyone was going, oh blimey. I was just wanting
right way of putting it, Jim.
I was just wanting a bit of pulmonary rehab. But I think she was completely right to challenge us, and I'm really delighted that I think that gauntlet was picked up, and it facilitated a much braver and a much more empowering conversation, and it also helped us to really probably define the sort of the values and the motivations of the method and how we wanted to achieve it as well. And I think this slide just sort of really illustrates, particularly when it comes to environmental concerns, how kind of interconnected and interdependent we all are, particularly when we start to think around kind of personal health and planetary health. And the respiratory project, essentially the ability to breathe well, it really resonated. So yeah, next slide, if that's all right, Amanda. So we're on the cusp of quite a lot of change. So the health and social care are kind of coming together more formally in April 22. Now, for those of you that aren't involved in NHS or council bureaucracies, you might expect that we've analysed problems together and in common for a while. It's ridiculous, I know, but we haven't. But actually now we are. And we're looking through population health that actually we're really sharing data, and we're sharing the analysis of that data, and also beginning to have some really shared goals across the whole of the health and social care system. So it's far more joined up than it's ever been. And I think we often talk about the wider determinants of health, and by that we tend to have talked about sort of housing and pollution and our local environment. And I think what the pandemic's really illustrated to us in very black and white terms is that the sort of inequalities that go with all of those wider determinants aren't the wider determinants, they're the core determinants of health. So I think there hasn't been a better time when it comes to thinking about protecting our environment as a collective, of getting that message across together as both health and social and third sectors. So I think the planets are aligning in that regard. Next slide, please, Amanda, if that's all right. Yeah, you're going to hear this phrase subsidiarity a lot, and I think it goes with what Leanna and her colleagues have been describing about really trying to personalize what a person needs and trying to then reflect that back on how decisions are made as you go up and across the if you like the sort of health and social care systems, and that we're trying to make sure that decisions are always made as close to the problems and the populations as they can be, with a real awareness that the more abstract and distant you are from that, the far less responsive you can be to an individual. So we're really trying to get that embedded as a way of thinking. And I think you'll probably hear this in the context of something called place-based decision making. And it's trying to make sure that everything's not coming as central diktat from on high, but it's actually got a local resonance. I think as my sort of passing shot, I really want to emphasize that we've having more kind of trusted conversations now across some what would have been very traditional boundaries. They're happening all the time now. And I think if we're going to borrow one of Manda's phrases about getting transdisciplinary improvements, I'll let her explain that later. We really need those trusted relationships. And what I'd say to everyone is that actually the time you spend on building those isn't a sort of, and giving yourself the permission actually to have and develop those relationships isn't a nice thing. It's not an okay thing. Actually, it's really essential. And you need to make that investment of time in order to have these really trusted relationships that allow you to move dialogues on significantly. So that's my bit. I think, Melissa, is it back to you?
Yes, please. Last slide, please, Mona. So yeah, I just wanted to, if you just indulge me in a final thought, really, I came across this image and it really got me thinking about my experiences of working across lots of different groups. You know, every day as healthcare workers, we go to work and we stretch out the blanket and we catch people, don't we? And when I think back to the times that I've walked into meetings with different groups of people, for example, when I walked into Helston Medical Centre and met a new group of people I hadn't met before, a new group of sort of lucid, compassionate people that cared about these issues and wanted to do something about it. It was a really powerfully supportive action for me. And so every time this happens to me, I feel like the little bit of me that's fallen gets caught in that blanket. And so I would really want to encourage people, if you're not doing it already, just to reach out within your communities, as Jim's saying, across those different boundaries, that you know, rather than being within your own sort of echo chamber. Actually, it's so inspiring to look at different groups and what they're doing and how you can work together. And of course, as we do that, we're building our networks, we're building our communities, we're improving our resilience. And essentially, we're sort of supporting and catching each other as we go forwards. And it's great to be here today. This is another perfect example. There's a bunch of people on here, more lucid, compassionate individuals that I've not met before that are working on this. And it's really uplifting. So thank you, everybody.
Fabulous. Right, see if I can go back to... right, brilliant. Thank you, everybody. That has just been fab. That was very smooth, Helston. Beautifully coordinated, and the tech works and everything. But also a really great example of how, in actual fact, this is definitely about us catching each other. And that thing about transdisciplinary. Lots of people use the word multidisciplinary. Multidisciplinary just means lots of things in the same place. It doesn't necessarily mean that they're working together. And the point of transdisciplinary is that by working together in all the different bits together, you end up with something bigger than the whole, beyond sort of across all the disciplines. And that's really what we're all aiming for. So I think that what everybody here has indicated, that by working across your own discipline or across your own tribe or group or area of leadership, then extraordinary things are happening left, right and centre. And they are really, really, really inspiring. So thank you. Was the irony of apple trees outside a doctor's surgery won't be lost as an apple a day, etc. Thank you for that. Has anybody, hi Tracy, lovely to see you there. Has anybody got questions for the Helston tribe? I'm going to think of a really brilliant word to describe you all now, because you are, I mean, Melissa's got a whole wardrobe of hats all by herself, but all that collaboration and very transdisciplinary collective clout of everybody is just having extraordinary impacts. Any thoughts or questions from anybody? Apart from when do you sleep? Does anybody else know of any other area that is putting together these sorts of examples of that collaborative working that we can contact and connect to?
I think Maggie's got her hand up. I don't know if you can see that, Amanda.
Oh, yeah, I've just have Maggie and Sarah. So fire away, Maggie.
Actually, I just noticed that my hand was up and I thought it shouldn't be. So, but I could say well done, everyone, and it's lovely. As I'm familiar with Helston myself, I'm just so proud that you're concentrating on this so well. No, I'll perhaps think of a proper question in a minute. My hand isn't up.
Right, brilliant. In that case, thank you, Maggie, and thank you for congratulating your team. I know that it's been a huge collective effort. Sarah.
Yeah, I think you guys are actually inspirational, and I wish I could just clone you and bring you into the community that we're working with. Matt, this recording, will it be available for us to share with others so we can inspire others in our area?
Absolutely. I'll send out the cafe, just the one from last year, because we've still got all of those recordings to hear what other people are doing across the country, and this as well. I'll chop it up into sort of manageable chunks. And yeah, and Kath is saying quite rightly that what's happening in Newquay and the connections with Newquay Orchard, again, really, really fantastic relationships being built up there. And I know that sometimes this can feel like pushing water uphill, but you only need a few. We don't need everybody. We just need enough. Just need a few people that are seeing the connections, and those are the people that can actually encourage others. So yes, did you want to say anything else there, Sarah?
No, I was just going to mention Newquay as well. Actually, not necessarily not Newquay Orchard, but our lady Jo from DWP is doing stuff with Storehouse, bringing lots of different organisations together. Bill, I think, has been involved in trying to get something similar replicated in the Bugle area, and that's across lots of different organisations. And that certainly in Bugle, that's involving social prescribers as well. So there's kind of coming from a community angle with health coming into that as well.
Absolutely. This is very emergent. We are absolutely making it all up wherever we are. And that's why all these different models are really, really useful, because they're showing us a million different ways to be brilliant. Jim, you wanted to say something there?
Yeah, it was just to say I wouldn't underestimate the power for doctors to be slightly competitive. So, so by all means share it. I think there is a huge amount of good work going on in other surgeries, and I think if you just nudge them, and actually that could be a bit of a gauntlet to share to say to Bill, actually, you know, this is what primary care is doing. Come on, you hospital consultants. And actually I could easily see how you'd have a competitive interdepartmental part run, that's for sure.
Oh my God. Blokes and clinicians, enough said. But yes, absolutely.
The most competitive people in my practice are not male by a million miles.
Okay. Well, in that case, I stand corrected. Power to everybody's elbow in that case. But yes, it can be really, really. It's fantastic to see what other people are doing. It can be inspiring. It can also give you somebody to go back to, saying, oh my God, I've got this complete head wrecking thing. How did you deal with the head wrecking thing? And they can go, yeah, I wrecked my head too, but then we found a way through, because we are all making this up. Bill, Rupert's saying very inspiring. He'll try to work more collaboratively in St Ives. And Kawita's saying that's why she loves the Green Impact Toolkit, a bit of a competition. Absolutely. Bill, did you want to say something?
Oh yeah, I did. Yeah, so whenever I go to I mean, maybe it's where I'm at the moment, but whenever I go to these things and I listen to everything, I think I've got to speak to them, I've got to speak to her, I want to meet up with them, we need to have a meeting with them, and them, and them, and them, and them, and them. And I would like to do that. And it's just like, I don't quite know whether that is time well spent, or whether we should just do our things and get together a bit, or whether we should be trying to be bigger here, or whether we should leave Helston alone and just take their ideas. And do you know what I mean? It's like, do we get together, or do we how does it work? How does it work? Because you know, when organizations get big, everyone goes, oh, it's too big, we can't decide anything. But then when they're small and everyone's doing their thing, you don't always know what people are doing. And I mean, I haven't got a question. I'm just saying that we're all sort of lost in the middle of it, aren't we, really?
Yeah, but I would say I've no idea where you put your phone in these calls, Will, but it looks like it's underneath the toilet or something. Where
I'm on the sofa.
But I think it's a combination of them all. I think it's a combination of meeting people online and going, oh yeah, brilliant, oh yeah, I want that conversation, And I think it would be really great. I have tried to do this before, actually, in the years before COVID, where we got clinicians out to some fantastic green spaces locally. for example, to see what other people were doing. And it's always a complete, it just takes the top of your head off. And also getting clinicians out of where they are is really good for the clinicians as well. So I think there's definitely some appetite now for doing sort of mini field trips. When we were running our little social prescription program down on our land, Jim from Badrigi would regularly bring his trainee GPs out, even if it's just for sort of 3/4 of an hour at lunchtime with a brew. And it was brilliant for us to have contact with the guy who was referring people to us. And it was great for him to be able to connect other doctors to this is one way of ensuring health and well-being. So I think there's definitely something to be said there. And I think maybe it's to do with sort of, maybe it's like little connections locally between local health centres and local green spaces. And then it would be great one day, if we're allowed back together again in the same room, to actually have a beer and discuss all this.
That's part of the thing. I think part of the thing with certainly the NHS is that, you know, Jim Tate and I have had a gazillion letters going back and forth. I don't think we've almost ever met and had the conversation. And that is, I didn't know he was interested in this at all. I mean, that's terrible, isn't it?
Well, but that's all,
you're terrible. There's loads of people like that.
Takes all the head off, and that's just the nature of the beast, because you're not really sitting on your thumbs twiddling them, are you, in health and care at the moment? So that's completely understandable. But what we can do is bring a different framing where those new connections come in, like my coryzal fungi. You see, always go back to the woodland. So yes, absolutely. So I will. I'll find a way over the next year, possibly, to see if we can set up some little sessions locally, and then maybe a coming together that might involve beer, because I think that's very important, and possibly even cake for purely medicinal purposes. Obviously, the cake and the beer. Melissa,
I would just say in response to that, Bill, is that sometimes you just have to like squirrel those bits of information away. So when that thing comes up, I need to speak to whoever it is that that I've got some names written down. I need to speak to Alan Bean about estates management, or it's all there, isn't it? And I think you just have those little repetitions, and then you get those wonderful coincidences where suddenly all the things come together because you've had these conversations, although you couldn't do anything about them at the time. I think there's a real sort of trust in Mother Nature and the universe to try and pull us together, because we've had these seeds planted. So I think it's all really valuable.
I think it is. It's never binary.
A word of hope. It'll come together.
It's the connection here, and it's the connection in real life. Absolutely, for sure. And some interesting comments here about how I think there is much more cooperation and collaboration. I think there's much more of an understanding between planetary health and human health stuff. There are still some GPs that don't think that climate is a health thing, but most of our leaders don't think climate is a health thing. It's not stopping us actually taking the action that's required on the ground. So bugger them. I am going to now invite Tracy to speak. Tracy's also from upcountry in England. And she was one of the co-founders, it's one of the co-founders of Pharmacy Declares. And we've had some really interesting chats already about polypharmacy and the massive carbon impact of pharmaceuticals and the massive negative health impact if they're wrongly prescribed or overly prescribed, and how maybe we can tweak that.